Excuse me, doctor. Look at all the attractive people in the auditorium at St. Joseph School of Nursing. My alma mater. Please allow me a moment. High class of 2017. If you are watching me right now, then Catherine, Libby, and Tammy are really excited. I need to talk to the doctor about a patient. But I am wondering how all of you are doing today. Post-exam 4. Just think you are almost finished your semester. I hear you are an elite class. Good for you. I know nursing school is really hard. And those select all that apply questions make you want to drink. But you can. And we'll do this. Dr. Rugg. I need to speak to you about your patient. Dawn. Gloves. Dawn is a 70-year-old female resident who is on day 6 of treatment with a broad-spectrum antibiotic for a urinary tract infection. Yesterday she began having severe diarrhea. It is continuing today, with multiple loose stools. I suspect she has C. diff.
That was impressive use of S-bar. Nurse Lippincott. St. Joseph School of Nursing prepared you well. I think your suspicion is spot on. I will order testing for C. diff. And we will take it from there. I have heard many nurses say that once you smell C. diff you never forget it. It is like déjà vu.
Yeah. I will be watching for the lab results to arrive so we can begin treatment.
Yes. I agree. If Dawn Gloves tests positive for C. diff I will write an order for vancomycin. Come to think of it, Mrs. Clark assigned Catherine, Libby, and Tammy vancomycin to research for their pharmacology class. Why don't you do the presentation for them? Since you are here anyway.
Okay. So, vancomycin is a glycopeptide antibiotic. This category of antibiotic is used to treat infections when other antibiotics are ineffective or contraindicated, including those caused by Staphylococcus aureus, epidermitis or diphtheroid organisms. As in the case of patient Dawn Gloves, vancomycin is used to treat Clostridium difficile-associated diarrhea, as well as treatment for enterocolitis. Vancomycin may also be utilized as a preoperative antimicrobial prophylaxis for GI tract procedures. Available forms of vancomycin include capsules available in 125 mg and 250 mg. Taken orally. Vancomycin only works in the intestines. It will not treat infections in any other part of the body. Vancomycin comes in a powder form for injections, as well as a pre-mixed solution for IV route. Vancomycin has a half-life of 6 hours.
Class. Are you still paying attention? Matthew. That is not a cell phone I see in your hand. Is it? Please continue.
OMG. I am not boring you, am I?
Please pay attention to Nurse Lippincott. She is helping to prep you.
Back to vancomycin. Adverse reactions include fever, pain, hypotension, thrombophlebitis at injection site, also tinnitus, nausea, nephrotoxicity, leukopenia, neutropenia, eosinophilia, dyspnea, wheezing and superinfection. There is a syndrome called Red Man syndrome that may occur as a result of rapid IV infusion. It is an idiopathic reaction. Signs and symptoms include flushing, erythema and pruritus usually affecting the upper body, neck and face, muscle spasms in the back and chest, and hypotension may also occur. Drug-to-drug interactions can occur between vancomycin and aminoglycosides. Amphotericin B, cisplatin, pentamidine. Non-depolarizing muscle relaxants may enhance neuromuscular blockade. Monitor patient closely. Effects on lab results include increased BUN and creatinine levels. Vancomycin can increase eosinophil count. or decrease neutrophil and white blood cell count. Contraindications and cautions include known hypersensitivity to vancomycin or its components.
Don't forget to use caution in patients receiving other neurotoxic, nephrotoxic, or ototoxic drugs. Also in patient over 60 years of age. And those with impaired hepatic or renal function, hearing loss, or allergies to other antibiotics.
Make sure to educate a patient who is prescribed vancomycin. Tell them they need to take the entire amount of drug exactly as directed. If the drug is being administered intravenously, tell the patient to report any discomfort at the IV site. Also, patients need to immediately report ringing in the ears or any other adverse reactions to his or her prescriber.
That's me. I would be considered a prescriber. Did you know illegible handwriting is a requirement of being a prescriber? LOL. I am only kidding. Ha ha ha.
It is a good thing you prescribers have we nurses to figure things out. I am only kidding. Ha ha ha. I hope you feel more acquainted with vancomycin. Joking aside, C. diff can become a deadly diarrhea. So be aware. Good luck to you all as you finish the semester. Enjoy your summer break from school. Come back in the fall and slay this course. Thanks for watching. Bye bye.